May is National Stroke Awareness Month, and Encompass Health is helping us stay informed. And here with more is vascular neurologist Dr. Ralph Gonzalez and Encompass Health CEO Marcus Braz. Welcome to the program, Doctor. Marcus, welcome back.
Thank you.
And is National Stroke Awareness Month. We're going to talk about that in a little bit. But if you could tell our viewers what your role as a neurologist at the Manatee Memorial Hospital is, Doctor.
Well, I direct the stroke programs at Manatee Memorial Hospital and Lakewood Ranch Medical Center. And as the medical director, I institute all protocols and procedures that involve the acute care of stroke. I also, on a day-to-day basis, take care of strokes that come into the emergency room and at night and things like that.
So how long have you been there? You've been there quite a while, so I would say you're very knowledgeable in this area.
Been there 19 years, yes.
Mm-hmm. So when what is the stroke treatment now, and how has it evolved over the time that you've been involved with this?
Well, stroke treatment's involved exponentially over the last 20 or 25 years. Mm-hmm. Initially, our only stroke treatment for acute stroke was IV Activase, which is a clot-busting drug. Then over the last decade, and particularly in the last 5 years, we've been able to remove clots mechanically using catheters, much like cardiologists do for heart attacks.
So you insert something into
Yes, insert something into the groin, microcatheters threaded up into the brain, and the clot is removed through a couple of different mechanisms.
Okay. Does that come out after you just, this is the procedure?
Yes,
and then
the catheter comes out afterwards, and hopefully with it the clot, which improves blood flow to the area that's having the stroke.
Okay. All right. Now, Marcus, you're going to tell us, after the patient is treated, they go through rehabilitation. What is the best way for that to happen, and what does Encompass do to facilitate that?
Great to be here again, Nancy. Thank you.
You're welcome.
Recently, the American Stroke Association issued its first guidance in regards to the best place for patients to receive therapy and rehabilitation following a stroke. And those guidelines consistently demonstrated that a patient who received inpatient rehabilitation services at a hospital such as Encompass benefited the most functionally from those services.
Okay, now what do you do exactly to help rehabilitate a patient?
In inpatient rehab hospitals such as Encompass Health, who's treated over 400 patients just last year, the patients get intensive physical, occupational, and speech-language pathology therapies, and that's provided by a specialized team including rehabilitation physicians and specialized trained nurses, and all of those folks work together as a team. And just last year, the functional gains that our stroke patients achieved were in the top functional gains for patients who have received rehabilitation following stroke in the country.
Wow, that's great. You guys are amazing. Now, Doctor, once a patient has a stroke, they're preparing to go to rehabilitation. What do you do to get them ready for that interim step?
Well, after the acute phase of the stroke is passed in the hospital, we have our own therapists, physical therapy, occupational therapy, and speech and language pathology all evaluate the patient and assess their rehab needs after discharge. Some patients will do very well and be able to go straight home, but the vast majority of patients will end up needing acute rehabilitation. And as Marcus stated, the American Stroke Association has now put it into a guideline form that the best outcomes with stroke patients are noted in those that go to an acute rehab facility, like Encompass.
Now, and that can take, depending on the person, the severity of the stroke, it can vary in the times how long they will need to be in rehabilitation. Is that correct? Okay. And then after they leave you, how do you follow up with them? I mean, do you have in-home
Oftentimes,
care?
those patients will get home health care, and then obviously following up with their physician is very important.
Okay. Now, with health, May being Stroke Awareness Month, can you tell us what's coming up and what the community should look for from you? Absolutely.
I'm very excited to talk about the event we're having to celebrate Stroke Awareness Month and stroke prevention. at Encompass Health of Sarasota on May 22nd, Wednesday. We're going to have an interactive healthy cooking demonstration, interactive art therapy, creative connection demonstration. Our Executive Vice President from Encompass Health, Barb Jacobs-Meyer, will be there, as well as Kathy Formeyer from she's an Executive Vice President from the American Heart, American Stroke Association to give a presentation. We're also going to have a stroke reunion from our former stroke patients who will come and visit us, and the therapists and the nurses and the physicians who cared for them. But most importantly, it's an opportunity to educate the community about how stroke is beatable and preventable.
Okay. Before we close, I'd like to ask you that preventable. What can somebody do to prevent a stroke? Is that possible? And how do you, I know there's warning signs. Could you share with us what those are?
Well, we have different acronyms and different things, but one of the more common ones is B FAST. So B stands for balance, E is for eyes or visual problems, FAST is for face or drooping of the face, A is for arms, weakness in one of the arms or the other, S is for speech, so slurred speech or inability to speak, and T is for time, because time is of the essence in these sort of situations. So this is the kind of thing that if you think you're having a stroke, you really want to call 911. And EMS has protocols in place that will take you to the nearest, most appropriate stroke center. Okay.
And before we go, the date and the times, please, Marcus.
May 22nd, Wednesday, from 11 to 1 p.m. At Encompass Health in Sarasota on Edge Lake Drive. And we're going to talk to you about, again, preventative opportunities such as healthy eating, exercise, and again, just celebrating the recovery of our former stroke patients.
Awesome. Great. Well, thank you both for being here.
Well, thank you.
All right. Thank you.
Next on Suncoast FYI, we get crafty with some special guests.